Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about Epstein-Barr virus and its link to the development of multiple sclerosis. Some of you may have seen in the media within the last few weeks, there were a bunch of articles published that were talking about this study that came out that, in essence, was linking a history of an Epstein-Barr virus infection, and Epstein-Barr virus is what causes mono, so basically folks who had true mono. And by true mono, I mean not a pseudo mononucleosis, which is a mono-like syndrome, which is caused by other viruses. But if a person actually definitely had mono caused by the Epstein-Barr virus, then their likelihood of developing multiple sclerosis I believe it was within a 10-year period or so afterwards, was significantly higher than folks who did not have a history of Epstein-Barr virus. And then the study further went on to talk about how there's a body of evidence that indicates or suggests that it's not just that Epstein-Barr virus kind of triggers the cascade of events that leads to this autoimmune demyelinating condition known as multiple sclerosis, but it actually is as a causal component that's actually driving or rather, it's not just correlated, but it looks like it might be a causal component that actually is perpetuating some of the pathophysiology of the MS. So suggesting, again, that perhaps treating against Epstein-Barr virus to treat it and get rid of it or knock down the numbers of it, like the viral load of it, could be helpful for the treatment of MS moving forward. So it's really interesting paper. It's exciting, I think, because from a conventional medical perspective, or we'll say a traditional medical perspective, it's like, oh, here's a new future treatment target that maybe we'll look at down the road. From a functional medicine, integrative medicine, naturopathic medicine, etc. medicine perspective, it's like, for some of us, it's like, oh, that's nice to get some validation because we've been saying this for years. This is what we've been seeing in practice, that viruses and certain other chronic infections are oftentimes come up when we test our patients with an MS diagnosis. And it's something where when we treat for that, some patients do display clinical improvements or better stability of their condition or what have you. So this is kind of like a nice validation of like, oh, this is what we've been seeing clinically. It's nice to have a study backing up what we've been seeing clinically for a long time. So the reason that so that's the preamble to this video. The purpose of this video is to address a question that was asked by someone who I posted the article or an article about this on social media, and so there was a follow-up question to that, which, if I'm remembering correctly, I don't have it in front of me, but if I'm remembering correctly, it was something to the effect of, I had mono X number of years ago. Should I be worried? / should I be doing anything to perhaps reduce the chance of developing MS, which is a really, really good question because on the one hand, it's like, oh, this is exciting news for folks where they have an MS diagnosis, or for folks who have a loved one or a friend or whoever who has an MS diagnosis. But on the flip side, it's sort of like, oh, I had this history of mono, and like, is this giving me something that I should be worried about? So it's a great question, and ultimately, I don't know if it's something to be worried about. It's something definitely to be thinking about. But if I've thankfully not had mono that I know of, at least, and if I had a history of that, or a loved one with a history of that, then what I would be strongly considering for me, bearing in mind that nothing that I'm about to say should be construed as any medical advice, and please discuss with your personal healthcare authority or personal health authority, maybe not healthcare authority. Like, don't contact your public health department about this. You could, but you don't need to. Consider speaking to your personal clinician about, please speak to your personal clinician about any health decisions that you decide to make for yourself. But if it were me, I would consider doing a few things. One thing is that I would consider running a comprehensive serological panel to tell me whether or not there seemed to be any current Epstein-Barr virus activity in my body. This is a bit of a longer, convoluted topic than what I'll get into in this video, but the long and short of it, at least here in Canada, the standard testing that's done for Epstein-Barr virus is really only able to tell you whether you have an acute infection or whether you had it at some point in the past. And to my understanding, That is the only thing that can be tested for through our provincial healthcare systems. And that's all well and good to know about, but what's more useful, in my opinion, in a context like this, is whether or not there was, we already know there's Epstein-Barr virus in this scenario, but has that Epstein-Barr virus been reactivated? Or in some cases, is there evidence that the Epstein-Barr virus has actually been chronically active in the person's system, perhaps the whole time since they had it? So there are more elaborate antibody panels that can be run to look for evidence of whether or not there's been a reactivation or if there is a chronic manifestation. So it's not just a question of, because again, in the case of this person's question, it's like I know I had mono, I had EBV, but is it possibly going to cause a problem for me MS-wise down the road? It's like, well, one thing that I think would be useful to know, and again, I don't know if this is something that would be crucially important or not, but just putting on my thinking cap and thinking like, well, what would I do if it were me? I'd want to know, is there any evidence that maybe there's been some reactivated Epstein-Barr virus in my body, or if there's a chronic manifestation of it? And the standard antibody testing cannot determine that, at least here in Canada. I don't know what the situation's like in other countries because I've only ever practiced here. So I would be curious about that. And if that test came back saying that, yes, there is evidence that there's been a reactivation or there is evidence of a chronic viral EBV infection, then what I would likely do as a next step would be running an Epstein-Barr virus titer to see, well, what is the actual level of Epstein-Barr virus in my body? And is it just, a little bit elevated? Like, let's say it comes back that, oh, it's reactivated. Okay, is there just a little bit in my body? Is there a ton of it? So I'd want to get a quantification of that. So that's the one thing I would look at. And if it was elevated, then I personally would use antivirals to treat that until the titer was, down to an acceptable level or was no longer detectable. The other thing that I would consider doing if it were me is I would consider doing some testing to investigate the health and integrity of my antioxidant status. I would do some testing to see what my genetic status is with certain genes that have to do with my overall neurological health. So like antioxidant producing genes, brain-derived neurotrophic factor gene. I'd look at my methylation cycle related genes, that type of thing. And I spoke about this testing in my video probably 4 or 5 or 6 videos ago. It's part of my biohacking for optimal health series. It's I think video number 2 was about genomic testing, so I go into this in more detail there. So I would consider doing that type of testing, effectively looking at quite a bit of the biohacking testing actually, just to see how my overall neurological health and integrity risk factors are looking. Because at the end of the day, if I ran all that testing and I saw, oh, I don't seem to have, like, there's only evidence of a past EBV infection, there's no evidence of a chronic or a reactivated one. Okay, check that off the list. That's reassuring. And I do some other biohacking testing. Hey, that's looking good too. Then I would personally feel quite a bit more comforted and probably not be too concerned about going out and I wouldn't be too concerned about taking any additional steps besides just trying to live a nice, healthy, lifestyle moving forward. I already do this in terms of working with a diet that's anti-inflammatory and good for my immune system, like a non-immune system activating diet, like a non-pro-inflammatory diet, essentially. If I wasn't already doing that, I would consider doing that too, just given that MS is an autoimmune condition. And sometimes folks with an MS diagnosis do quite a bit better when they're working with something like an autoimmune paleo diet or just a regular paleo diet or a low lectin diet or things like that. So I'd probably consider something like that if I wasn't already doing that type of diet. So those are my thoughts about this. I hope that is helpful for you and anyone else who's been thinking about this topic. If there's any follow-up questions about this or any other topic, just post in the comment section below, and I will leave it there.